It's now time to turn our attention more locally. So with that, it's my great pleasure to introduce Andrea Toledo. Andrea Toledo joined Family Service Agents of the Agency of the Central Coast, FSA, as the Program Director for Suicide Prevention Services in January of 2022. She has worked in the community development field for more than 35 years across multiple not-for-profit businesses, community, and fundraising disciplines. Andrea is a graduate from Leadership Santa Cruz, class number 10, a past board member for Families in Transition, Santa Cruz Little League, and Chamber of Commerce Santa Cruz County Chairperson Woman in Business. She has driven and successfully implemented special events, capital campaigns, and program growth for Santa Cruz Seaside Company, Boys and Girls Club, Habitat for Humanity, Planned Parenthood, Institute of Heart Math, and Skills Center or HOPE Services. Please join me in welcoming Andrea Toledo.
Today I'm going to talk about just suicide prevention services, and I was going to primarily focus on 988, but I'm going to try to fill in some information that Carly was going to share with us. So, suicide prevention services, we serve Santa Cruz, Monterey, and San Benito counties. So there we are. Our little arrow right there. So we are one of suicide prevention services locally. We are one of 12 California call centers answering the 988 lines, the National Suicide Lifeline, Crisis Lifelines. We are an accredited part of this community. We are very active and passionate in terms of developing what 988 is in our state and also nationally, and because there's so many changes coming through. And this really is, for behavioral health services, a watershed moment, particularly around 988. There is so much attention and funding and support that's coming in all the way from the White House, down through our states, down into our local communities, to ensure that we're providing our community with behavioral health services and really looking at the continuum of care around behavioral health services. And their 988 lines are part of that overall network in terms of what Christine was talking about. So 988 launched really informally, or I did a soft launch last July 15th. And so during that time, we've been working with the folks who are answering our lines, and I'll get back to the number of calls increased and what we're doing in terms of making sure we're answering those lines. But when people call into our lines, first of all, it's confidential, it's free, and we, in terms of collecting data around if we're serving youth or what kind of demographics we're serving, we only get that information when people share it with us. So in terms of looking at some of these data points, just keep that in mind in terms of demographics and what things look like. When people call into our lines, we use a very strict call framework in terms of doing risk assessment with our callers. The most important thing that we do on our lines is, number one, we connect, we listen, but we do safety. Our number one concern in terms of when we are ending that call with that caller, I'll go into imminent risk in a minute, is, are they safe? Do they have a safety plan? And where are you in terms of that risk? We do ask the questions. Did you have suicidal thoughts today? Have you had suicidal thoughts in the past 24 hours? And we go from there. And we look at doing, from there our conversation grows. We have a very strict call framework that we must follow in order to make sure we are meeting the standards around our AAS accreditations, and we're doing the work that we need to do so when our callers call, we're listening, we're connecting, we're assessing their safety, and we're moving from there. And that's what our responders do. We spend about 50 plus hours making sure our responders are trained. We talk a lot about compassion, listening, being non-judgmental, because we don't know who's on the other end of the line. People from different ethnicities, from LGBTQs. We have we don't know, but we call. When they call, we listen without judgment, with compassion. That's really kind of fundamental to the work that we do and connecting to those callers. We listen to what they have to say, and we go from there. And again, it's around making sure they are safe, around, do you have a plan? Do you have access? Have you taken pills? Do you have access to lethal means? and it's listening and responding thereof. And I really want to do a huge shout out to we have 59 right now, we have 59 volunteers who are answering our lines, right? And until last March, our phones were only answered by volunteers. I don't know, has anybody out there been on our lines? You know, as volunteers? Hello, Miriam. If you're interested, we are always looking for volunteers. We have a very rigorous training program, as I said. It's about a 10-week program. Thursday nights, Molly Taus, who's our Associate Director of Training, she runs that program. We are also doing condensed responder training because we are bringing on staff responders. Since last March, we have added an additional 16 staff responders to our lines. It is, we're getting, sometimes we have 2 people on the line, sometimes we have 4 people on the line, because that's the number of calls coming in, and we want to be able to pick those up locally. Again, we answer those calls locally, and let's see what it looks like. So what happens when somebody calls 988? It's like this big 988 thing out there. It's pretty simple, actually. Somebody calls 988, it bings into the national line. It tracks it based on the area code, so that's how we get local calls, again, based on the area code. We serve Santa Cruz, San Benito, Monterey counties. Person calls in, press 1 for the veterans line, and press 2 for Spanish line. It also has about 200 different languages on that line. So, and if they don't press one of those 2, they come to us. We pick up the line. That's how it works. If we're not available or responders are on the lines, it goes to our backup call center in California, which is WellSpace. So our job is to answer those lines and answer them quickly. When we get the people on the line, we do our risk assessment. If somebody is at imminent risk, this is where a lot of kind of the discussion's happening. What happens with if someone's at imminent risk? Our protocols and our policies dictate that we reach out to our 911 partners. We are working very closely with our 911 partners to ensure that we have a very clear and agreed to handoff policy and process. And I have to really give a shout out again to our 911 partners. We have had many, many discussions, are continuing to work on how do we improve that handoff and what does it look like in terms of how can 988 support our 911 partners to ensure that whoever is dispatched out to that particular situation is appropriate, has the right people embedded in the group that's going out, and it's done in a way that is respectful and the way that is the most effective. Once again, only about 2% of the calls that come into our lines go to 911. So it's a very, very small percentage. It's an important percentage, but that's what happens when people call into our lines. The work that we do, again, is around safety planning, safety assessment, but really what we're doing more and more of is connecting our callers to our local resources. So we work very closely with our community partners to ensure that we provide the caller, we can do a warm handoff, meaning we keep them on the line while we connect to someone else, making sure that that connection does happen. We do a lot of, give a lot of phone numbers, and then we do follow-up calls for our callers. Like, were you able to talk to the Rape Crisis Center? Were you able to talk to behavioral health? So we are doing more and more follow-up calls to ensure that, kind of again, that connection continues to happen. So once again, the National Lifeline 988 launched last July. So these are numbers between 2021 and 2022. And these are the calls that we actually answered coming into our line. So as I said before, March is when we started hiring folks. Our calls were answered by volunteers doing the very best that they could to answer the calls coming in. Knowing that 988 was going to launch, we did a tremendous amount of work ensuring that we were hiring staff responders and training our staff responders and getting our lines secured and getting our systems set up operationally so that we can handle the volume coming in. So just from 2021 to 2022, the number of calls that we actually answered went from about 1,800 to about 3,000. These are the number of calls we've actually picked up and talk to that person on the other end of the line. That's a lot of phone calls. And once again, really, our volunteers and our staff responders have done an amazing job just in terms of being ready, being focused. And I have to tell you, when people call into our lines, the most important moment in our responders' life at that point is listening to who's on the other end of that call. That is what they're doing, and that's what they're focused on. In terms of the calls coming in to our lines, we had about a 93% increase. So what that says is, well, no, 988, it's easy to remember, right? Before there was like a 10-digit number here and a 10-digit number there. Now it's 988, and people are remembering the number. As Christine said, it's 988 mental health, 911 for emergency services, and then it's 211 for community resources. So people are remembering the number, and we're getting more and more and more calls. So in 2021, we had 2,700 calls. And just in 2022, these are number of calls coming into our lines. We had about 5,200 calls. That is a tremendous increase. And once again, we are passionately and dedicated to ensuring that we're covering our lines. Because when we answer our phones locally, we're local folks. We live here. We use our services here. Our kids play on the same teams together. They, same schools. We can, we're locals, and we want to be able to make that connection with the folks who call the lines. We do get calls from folks outside of our area, and and if there is an emergency, we actually look at their local kind of PSAP, like who's going to be dispatched where they are locally as best we can. We do not have a geolocator for 988. So we're really reliant on, again, our PSAPs and our local dispatchers, and then we're reaching out to other resources and other communities if we need to. And right now, we're working with the 988 partners in terms of geolocators and how do we reach out to other communities when there's imminent risk, and then connecting folks to local resources. Uh-oh. There we are. Did I miss someone? No. There we go. So who's calling into our lines? Again, this is for folks who choose to give us that information. So let's talk about kids today. So in 2022, about 11% of the folks that we were able to collect data from were kids. That's 12 to 17. It did increase over the last year. We are seeing kind of a trending up in the number of kids that are calling our lines. Interesting enough, a little off the subject, but really we're seeing a large increase too in terms of suicides is around our senior population, and as Christine said, also in terms of young men of color and also for Latinas, young Latinas, there seems to be an increase there as well. So kids are calling our lines, and how do we work with our kids? Same way that we work with all of our callers, to establish a connection. Listen to what they're saying. Do not be judgmental. It is anonymous. They will share what they will share, and we'll make sure they're safe, and we'll connect them to resources if that's what they need. And these quotes or this information is based off of call reports from our responders, and we do call reports for everyone who calls in. I have to say, reading those call reports, like all of them, really were heartbreaking, These kids are having a tough time. As Christine said, those numbers are going up. They're experiencing a tremendous amount of anxieties, hopelessness, particularly in terms of LGBTQ communities, feeling completely isolated. And a lot of it is around when they're calling and they're saying, I can't talk to my mom. My mom doesn't want to hear it. They're fighting. They're drinking again. They would be better without me. They don't care how I feel. I can't tell them. They tell me that I'm faking it or I'm pretending. So we get those calls around family dynamics. So what does that say, I guess, to us is how are we going to educate our parents and people in our households, care providers, partners, in terms of, again, being aware of what's going on in their homes and with their kids, and that's certainly around education and outreach, which Colleen's going to talk about a little bit, but I will mention that as well as we move forward. So, again, this is for kids being able to call and share some of this very personal and tough information with our responders. First of all, I'm so happy they're calling and they're reaching out, which is a huge step for our kids. But again, how are we serving them in our communities and our schools? And I know Farrah's going to talk about this later, but it's all about, we're all interconnected in terms of this network. And with 988, really we are a bridge to compassion. We are a bridge to resources. And so we're not doing counseling on our lines. We keep our lines open for people calling in who are suicidal, who are in crisis. And so we really work to make sure we're following our call framework, but then providing the bridge and the resource to the caller for these kids in terms of helping them to develop their natural resources. Who can you call to be with you now? Can you talk to your mom? Can you get your mom on the phone? Can you get your partner on the phone? Who can we reach out together? What are you doing to be safe? Okay, you have your dog. Are you going to hug your dog tonight? What is your plan? Can you promise us that you are not going to kill yourself in the next 24 hours? And if you feel like killing yourself in the next 24 hours, will you reach out to us? That's the agreement. And then we develop plans around that. So again, these are what our kids are talking about, relationships, in terms, and then they feel very stressed out with grades, expectations with grades, parents not understanding them, and then of course you do have the people are a very heightened acute sense of suicidology in those moments, and that's again the imminent risk. And that's when we reach out to our community partners and our 911 dispatch. Imminent risk here, has taken a handful of pills already, has more in the bottle. She plans to take it. Her dad is unwilling to help her. Imminent risk. We also are mandated reporters, so we do hear about abuse in the household, and we take that very seriously. And we do get quite a few calls around that. Again, we're safe. We're a safe call. Again, it's just been a community lift, and it will continue to be a community lift in terms of not only our lifelines, but just getting out and working with our different communities and schools and classrooms and parents and businesses around reducing the stigma, know the signs, how do you ask the question, and where do you go? And our big, message is call 988. We are not a panacea to everything, but we are, when you talk about no wrong door, we are a door. We are a big door, and we will continue to be an even bigger door moving forward. And these are our resources for suicide prevention services and our family services. So we do offer training and classes. These are free. These are around know the signs, how do you ask the question, where do they go? We do this for individual classrooms. We do it for health professionals. We do it for educators. We have safe talks, which are about 5-hour trainings, and then we also have assist trainings. And we've just developed, we call it we're still debating the name. We're calling it a space training, and that's about a 1-hour training, like Intro 101 to suicide prevention awareness. How do you talk about it? How do you ask the question? How do you, what does it sound like when you ask the question? What does it sound like when you're called the lifeline? We have the video, same one you had, Christine, we have embedded in our trainings. It just makes sense. And just reducing stigma. We have flyers and posters both in Spanish and English to post in workrooms, to post at schools. We have posters, we have flyers around 988. We also are very involved in social media campaigns with our 988 partners and with Know the Signs and our different SAMHSA-sponsored programs, and really looking at September being a National Suicide Prevention Month. So we will be partnering with our other communities, San Benito, Monterey, Santa Cruz counties, to do a Central Coast campaign, and that will be happening September. Yep. And then we also offer suicide loss support groups, bereavement support groups, and we have a suicide loss bereavement program. And so, as a suicide loss survivor myself, I understand the significance of being able to talk about it with people who have that shared experience. And we offer those via Zoom, and we are now starting in-person classes as well. And those are peer-led and facilitated, again, with people with shared experience. And we also do have, we do send out loss packets to folks who have lost someone to suicide. And people call our line looking for different resources, and we may send out a packet and not hear from them. It's usually a couple months before they actually get back to us to want to be part of our grief support groups, but at least we're reaching out to our community members, and we do nice handwritten cards in those lost packets, just saying, you know what, and I'll send those cards too, saying, I have a shared experience, you will get through. And again, that's something we offer through Suicide Prevention Services. Okay, so what's next? Our real focus with our program is to, number one, make sure we're getting out and doing our education, and our safe talk and our space trainings, just to get in front of folks. If you're interested in having us coming to your business or your organization, just contact us. We'll schedule it. We'll come in. We'll do the training. It's about an hour. It's Suicide Prevention Awareness 101, which sometimes you just have to hear it, and it just sticks. And again, we're happy to do that. Those are free. Just contact us, and we'll come in and do those presentations with you and for you. Again, our public relations, social media campaigns, we do a lot of Facebook, Instagram. We don't do TikTok, but we have a new website, which will have a lot of our resources listed on there. Again, looking at increasing our lifeline staffing, our coverage, and also we'll be moving to text and chat. So our local lines, we're doing text and chat. We are contracted to provide 8 hours a day, 7 days a week, beginning July 15th this year. We are in the process of hiring responders to do our text and chat. And what we're finding with our colleagues who are offering it, that's really that's really for our youth, that's their preferred modality. And so the number of youth that are texting and chatting is exponentially increased in terms of people using the line. So it's a new experience for us. We're learning. We're partnering with our other Lifeline partners and Vibrant, who is the national organization that runs those lifelines, to ensure that we're providing our responders with that text and chat training, as well as how do you serve youth who are calling into our line. So that's a whole nother training that we're doing with our responders, because it is an increased population that we're serving. And also, this is kind of fun. So we are just starting to offer, I gotta put my glasses on, a new treatment program for people who are actively suicidal. And that is a brand new program that we're working through Family Services Agency. Bill McCabe, who's our CEO, he is, he's directing that program. We're launching that program, and we're very excited to see what that's gonna look like moving forward. So if you want more information about that, please connect with me or Bill or anybody at FSA. And I think that's it. Okay. Thank you so much.
Dr. Faris Saba grew up in Iraq and Ecuador before coming to the United States to study at UC Santa Cruz, where he received his bachelor's in psychology. He received his master's in education from San Jose State University and his doctorate in educational equity from UC Berkeley. He has worked in education for over 30 years as an instructional aide, teacher, university instructor, and school, district, and county office administrator. He was elected Santa Cruz County Superintendent of Schools in June 2018. Dr. Saba believes wholeheartedly that education is about serving the whole child, to disrupt inequitable practices and uplift the student voice. Welcome, Dr. Saba.
What a pleasure it is for me to be here with you. It's such an honor. I've participated before as a participant in the past, and to be up here, it's very special to me. I want to thank the Calciano family for continuing this amazing tradition. And I also think that now more than ever, the work that we're doing, the discussions that we're having are this moment. I don't know if it's ever been more important for us to be having these conversations. I also think that in this moment, there's a consensus among educators and providers and legislatures and families and students that we have to do more to support our youth. It's an incredible challenge, but it's also an important possibility for transformative change. Let's see if we can get the slides going. All right. As Dr. Moutier discussed, we recognize that we're in a mental health crisis. It's a national phenomenon. But we also know that it is hitting us here at home. I think about a young person who is part of my family, who's very close to me, who's 12 years old, and who is struggling with suicidal ideation. And I often think about, when we're talking about programs in education and how we're supporting our youth, I think about how this young man is experiencing those interventions or those programs or those services, and what things are working and what things are not. When he came into the educational system, based on the data that we know here in Santa Cruz County, there was a 27% chance that he was going to experience anxiety. There was a 24% chance that he was going to experience depression. There was a 13% chance that he would answer yes when asked if he had seriously considered suicide in the last 12 months. Now, if we take that data and we look at it a little bit more closely, you'll see that for high school students, those numbers are much higher. We see that for black students in Santa Cruz County, they are 10% more likely to have seriously considered suicide in the last 12 months. For students who identify as female, they're twice as likely as their male peers to have considered suicide. And if students identify as LGBTQ, they are more than 3 times as likely to have considered suicide, seriously considered suicide in the last 12 months. This national trend is happening right here, and it is something that calls us to action. And I'm so grateful for this opportunity to be able to speak with you and to be around people who are dedicating their lives to help protect, support, and save our youth. This trend, as Dr. Moutier mentioned, was already increasing before the pandemic. We often think about the pandemic as causing something, but of course that's not true. I think there was some maybe an increase as a result, but the trend was already going up for our students before the pandemic, and it's continuing going up after as well. And the causes, I think, we often try to oversimplify what those causes are, and often we pick on one thing. It's social media, or it's video games, or it's a bullying experience a student has, and we really think that is the answer that caused the situation. And I really appreciated what Dr. Moutier talked about the complexity of those factors, the biological, psychological, social, environmental factors that play into this. Because if we oversimplify the problem, we will oversimplify what we think the solution is. And this is obviously something that we've long struggled with and will continue to struggle with. And unless we start addressing the more complex systems that exist in school and in our society and address the social determinants of health, we will continue to struggle in being able to have a deep impact on this problem. I show you this graph. I already kind of shared the data. I already kind of gave away this point, which was just the discrepancy between our students who do not identify as LGBTQ and students who do identify as LGBTQ, and how they answer the same question. And this is coming from the California Healthy Kids survey, which is a survey we give out every couple of years. We're looking at 7th, 9th, and 11th graders. And the last three times it was given, so 6 years apart, and you can see that we are seeing increases among both groups, but also a significantly higher number for students who identify as LGBTQ. And this is answering the question, have you felt sad or helpless every day in the last 12 months? There's also a QR code there. We've, early on in my tenure as county superintendent of schools, we launched a data portal. We wanted to create a place where people can dissect data, play with data in a simple interface, where you can actually go in there and take a look at a variety of different factors, whether it's school testing information or responses on the California Healthy Kids Services survey, and be able to manipulate the data with a simple interface. And so you could use the QR code, or you could go to that address, and you'll see a bunch of different visualizations, maybe a little too much, but you can pick one. You can look at college going rates. You could look at a variety of different factors, and you could look at a variety of different questions the students are answering. Now, we're getting the 2023 data. It's happening right now. It's getting collected. We hope to have it in May, so we're going to have some updates, and we're looking forward to seeing what the data is showing us. When looking at the other question, which is, did you seriously consider suicide in the last 12 months? You'll see again that about 11% in the last time of our students who do not identify as LGBTQ saying that they answer that question in the affirmative, and over 3 times that amount for our students who do identify as LGBTQ. That one positive piece, I think, is that we are seeing a somewhat of a downward trajectory, but those numbers are just so frighteningly high. One of the things that has happened, I think, over the last few years, and especially because of the pandemic, has been the transformation of our schools into places that are trying to address those social determinants. The idea of community schools. What PVUSD did when they launched their Wellness Center and a Family Engagement Center, the idea of having these hubs for schools to be able to give out food for families, to provide a variety of different services. I think there is, part of this is a revolution in that schools are becoming the place where, a trusted place where families can come and get a wide variety of different services, especially in times of need. And I think that geography is important. We have access to students for a third of their lives, and I believe that we are becoming, if we aren't already, the single most important deliverers of mental health services. And it is for that reason, I believe, that our role when it comes to planning and organizing and overseeing and supporting the needs of students is so fundamentally important and focused at the school site. And in many ways, the services, I believe, have to become co-located at the school sites for that delivery. So you're all familiar with MTSS, the multi-tier systems of support that we use kind of to guide the different work that we offer. And you know, we know that part of our work is to try to offer this wide range of services for students, from tier 1 being something that we make available for all students in the school. Tier 2 is for students who have identified some concerns. They're able to get services like maybe group work when it comes to mental health, for example, or tier 3, our highest acuity needs students. This is all about building access and awareness, right? Awareness about the needs of students individually. It's about increasing that for everybody in the organization, not just the person who's a clinician on the school campus, but everybody in the organization having that understanding, that lens. One, about being able to understand what the needs are of students, looking for signs, and also knowing what resources are available. And then increasing access for those services, being able to ensure that we're not giving a phone number to a parent to tell them you have to call and try to figure out your insurance and hope that they're going to end up with the appropriate services at some point. I also believe that MTSS is also about transforming that school culture, creating a place where students feel that they belong, where they are not being othered, where they can bring their whole selves to school, where they're being supported and cared for and loved and appreciated for who they are. And it also is about parent engagement and about communication. I think that as we look at these tiers and we look at it from a clinical sense, there are some major gaps that I'll be sharing that exist in things that we're not able to respond adequately as a system. Areas that we're not able to, where students get into a place where they need help and we're not able to properly provide that help when it's needed. Our schools have been delivering services and investing in mental health for some time, and recently we've gotten a big influx in funding. We're hoping that's going to be sustainable, but a wide range of opportunities have been made available to us through grants and other sources. And we are collaborating with at least these 4 partners and these types of partners and many others to working with our own staff. So we've hired a lot more staff. Many people here from schools. Let's hear it for the schools, school staff. You're amazing. Thank you for what you do. Working with federally qualified health centers who are also amazing partners, working with the Santa Cruz Health Centers, and also I happen to be on the board with Salud para la Gente, amazing, wonderful organizations. Also, our not-for-profit partners are programs like PVPSA, like Encompass, amazing partners who help us, support us, help provide services to students, be able to provide a wide range of different services. And of course, County Behavioral Health. And working together, these different entities really are, we kind of have this friendly, a little bit of a struggle, because in some ways we're partners all focus on the same, but on the same mission, but at the same time we're fighting over clinicians, for example, right? Some of us raise the salaries, and then all of a sudden people shift back and forth. We just took somebody from the county program to be our director of clinical services. Is Lauren here? I just put you on the spot. And so because all of us are engaged in this, there's less outsourcing going on, and there's a little bit more of a power struggle that's taking place. And I think that's going to be one of the areas that when I start talking about gaps, I think that we need to be thinking about. The gaps are, if I simplify it, I would say that there's a need for better integration. The silos are real, and we talk about silos all the time. I also think that there's limitations when it comes to equity and access. A student that qualifies for Medi-Cal, for example, is more likely to get a certain kind of service. A student that is insured or underinsured may have a very tough time getting services, right? And we have to address that. I'll be talking a little bit about where our vision is, and I hope you'll agree with it, but our vision is that if a student, a young person comes in and needs help, regardless of their insurance, we have to be able to provide them with services, and that's where we need to get to. And so we're struggling with staff burnout and a limited staff. We are struggling because of complex and inconsistent funding sources. You know, we get a grant and the grant disappears, the service disappears. I think the most obvious gap when it comes to our MTSS kind of our continuum of care, if you would, is having a comprehensive and inclusive interagency forum that encompasses all the stakeholders and provides one place for planning, innovating, and reflecting. I think this would include county, school, private, public insurers, clinics, nonprofits, hospitals, stabilization units, and private practice clinicians, and of course, our clients, our families, and working together on this. The issue is that because there isn't a single entity that oversees this work, it creates there's a lack of incentivized coordination and a lack of accountability. We're left with this goodwill. We all are in it we all want to help and we want to do the right thing, but it often happens in situations where we're looking at each other, whether sitting at a table or at a school site where a student is in crisis, not knowing who is responsible to care for that child at that moment. And I think that, as with all organizations I've learned, there is what I call organizational inertia, which is that we're going to continue in this space until we do something disruptive to change this mechanism. Something has to happen. There has to be a concerted effort by multiple agencies to come together to break this mechanism to really reform in a different way. I think having a comprehensive, coordinated interagency system also needs to have clearer protocols between the different tiers on MTSS. There's a place where what we define as a Tier 2 service, and maybe somebody from County Behavioral Health defines it as a different tier, and what happens, it's not clear exactly what is the moment where the student is in need of a specific kind of service. And if we have different definitions for those things and different protocols, then yet again, we're not understanding each other, and it's not clear what is the needed service at that time. Instead of, it's often one system or clinician or emergency situation that dictates the changes. And so we end up kind of creating a new rule every single time we have a different situation. Another area is what we call we call it 3+ in the third tier, the students with the highest acuity needs. There seems to be an increasing number of youth who are needing or being referred to the highest level of care, especially in the form of residential treatment facilities. And we're actually seeing a reduction in the residential facilities for youth in our county. There's often multiple agencies that are working and we're competing for funding. When a grant comes out, we know we're competing against each other, or maybe we'll collaborate and write a letter, but it's not exactly a collaborative approach as we'd like it to be. In a perfect world, we would be able to collaborate and be able to work together and be able to create a unified solution. I also think it's extremely important as part of our process for these challenges is to make sure that we're addressing the voices of our community and our students, our youth, in the design of the solutions that we need to achieve. So what are we working on right now? There's a few things I'd like to share with you which we're excited about. I think of this more like short-term stuff as opposed to the reorganization or of the rethinking of our siloization challenge that we have. So we're working on building opportunities for wellness and belonging. So this includes, we believe in tapping into the resilience of our students because we recognize that their voice is really important. We partnered with Monarch Services to establish a Youth Mental Health Leadership Council of students, which is a great group of young people. The goal working with them is to help us as we think about different kinds of services like wellness centers, which I'll be talking about in just a moment. We've been collaborating with school districts closer than ever before, and I've been so inspired by the district superintendents who are so committed to wellness in our schools. We no longer see ourselves as places only for learning. We see ourselves as places for learning and wellness, and I think that is a mind shift that is exciting, and we have to embrace that responsibility. We're this semester, or in the next few months, we're doing trainings for youth mental health first aid, which is for adults who work with youth. Once we get 10% of school, we're able to then provide the training to teen mental health first aid, which is for 10th through 12th graders at the high schools. And so at this point, our plan is to train 600 adults and 2,000 high school students by the end of the year in hopes that they can then be allies with some skills and enough knowledge to be able to because they're going to be the first ones who are going to be hearing about those concerns from their peers, to be able to listen and to be able to help them get connected with needed services. It's, I think, one of the biggest countywide efforts for mental health that has been done. In our County Office of Education, we have a group of people called the Companion Project under the amazing leadership of Dr. Michael Painter. Give it up for Dr. Michael Painter, who's on the board with Calciano, who's been leading a lot of the efforts I've been talking about. So he'd be doing a much better job than me up here. But the Companion Project really is about case management for complex situations. It's like figuring out when the solution doesn't come easily and we shrug our shoulders, the Companion Project steps in and says, let me figure it out, and they work through the complex maze, whether it's insurance or service providers or working with probation or any other organization that's involved to make sure that there is a person, an advocate with the student every step of the way. We're also partnering with NAMI, which to offer more trainings for parents. We're going to be offering both the Ending the Silence training as well as the NAMI Basics, because we see, of course, parents as a necessary part of, and they're coming to us and telling us, what do? I don't know what to do. We have a great partnership with SafeRx to address substance use services and also addressing the concerns about opiate use in our community. SafeRx and Dr. Hastings doing amazing work to make Narcan available in our schools, in our community, and bringing information and awareness to save lives is something that's very, very important. So we've also created a social emotional learning community of practice, which has been going on for more than 2 years, and this brings together people from all over the county to talk about self-care and also provide them with a substantial amount of tools for them to be able to deliver in the classroom. Again, part of that Tier 1. And that self-care piece is also really important. We're struggling, we're losing teachers, we're losing our counselors and other staff. And so making sure that we're providing as much support to our staff. And I learned recently when there was the tragedy up in the SLV area, the importance of also supporting teachers, because a lot of times we mobilize to provide counseling support for students, and we just kind of assume that the teachers and the other staff, the support staff that are there, are part of the ones delivering the services and the support. And we all need to be a part of that. We all need to get that support as well. And so we need to also rethink about our trauma-informed practices to make sure that staff are a part of that, are getting those services as well. So wellness centers is something I think we're really excited about, something that we're hoping to have. The school district superintendents have made a commitment to build a comprehensive wellness center at every high school in the county, at all 8 high schools. And this is a model that we learned from Salinas Union High School District, where they have one at every high school and middle school. We got an architect to design the spaces. Each one will have a reception area with a navigator who will welcome students and train and listen to them and screen them. There'll also be a coordinator clinician who will be coordinating the services. There'll be a wellness room where students can go relax and calm down or whatever it is they need. There's a collaboration room where you could have multidisciplinary team conversations between different providers, and also group work for students. And of course, multiple offices for the clinicians who are providing the services. Again, geography is important. Bring the services to the students on campus at all tier levels. And I believe that there are some solutions, some exciting things that are happening that are going to allow this to be more sustainable than ever before. We've also have different designs for different size schools. So if you have more than 2,500 students, more like the Watsonville High School size, our schools are generally smaller than they are in like Salinas and other areas. You could look at the design on the right, but we're looking mostly at the design in the middle there, where it has about 3 or 4 different offices for clinicians. And so we have the footprint, the design, and we're starting to get funding. We're hearing the Santa Cruz City Schools has included it in their bond, which is really exciting. We received $1 million from Congressman Pineda's office that will help us build 2 of these locations. It is not, we have a lot of work to do to make it sustainable, but we think that we have to keep working hard and getting the community involved, because we may need to make sure. The worst thing that could happen is that we start this, it goes well, and then 2 years later we run out of funding and we shut it down. That is the worst thing that could happen. So we have to make sure that this becomes a permanent part of our school system, and then add it to our middle schools and then our elementary schools. So for our some of our expected outcomes when it comes to why we're doing this work, of course, is reducing stigma, having an open door to wellness. We want to make sure that having an integrated system, also prevention and early intervention, and also to build up those social and emotional skill building for our students. So as we start thinking about moving forward, I wanted to. One of the exciting things that's happening in the landscape right now is that we will be able to bill commercial insurance in 2024, which for the first time. And the state is going to set a reimbursement rate for us. And the insurance providers will be required to reimburse us for those services. So that, combined with Medi-Cal and other insurance, is going to give us a funding source that could cover a significant portion of the costs of the clinician's work. And we're understanding that it's not going to be as painful as Medi-Cal billing is, which is, I don't have to remind you how awful that is. We're also exploring a workforce pipeline, starting at the high school with CTE courses to begin, and then creating a mechanism for young people to start thinking about what positions they're able to get into and continue their education. What courses at Cabrera do I need to take? What do I need to do to complete my 4-year program? And then what master's program do I need to do, and where can I get my hours to get it, so that we can get this pipeline? It's a long-term project, but we need to do it for teaching, and we need to do it for counselors. Also excited about some of the changes with CalAIM. Some of it looks, we're trying to figure it out, but we do believe that there's some opportunities there for us to be able to get more funding for a wider range of services. Because the schools have been in the case management business since the beginning. And so this idea of separating what actually qualifies for certain services and what doesn't, when I think about what the school nurse does, what the teacher does, what the administrator is doing, there's so much of that support and case management that I think that we will be able to qualify to get reimbursed for in the future, and that's really exciting. And I think we have to be really creative. It was so exciting to hear about the UCSC Mobile Crisis Unit that just got started. Hearing about how they're teaming up law enforcement with mental health service providers, and they're the ones that are doing most of the work. And so law enforcement can now take a back seat, and it gets resolved in a way of healing as opposed to a way of somebody getting arrested and going to jail. So when I think about going back to the young person who's in my life, and I think about those statistics, and I think about the protective factors that Dr. Moutier talked about, that are going to help make sure that he's going to continue to grow in a healthy way. I have to say that I come to you with so much hope. I think the challenges are huge. I think I'm a realist in that way. But I also think about the solutions are really before us. It is a complex puzzle, but it's there. And I think that when I think about the energy of this Calciano Symposium and the energy in this room of the people that are here, not only the heart, but the minds that are here working together, and now the resources that we have available, I think, we have just greatness ahead of us and so much hope for our youth. And so I want to thank you for bringing that heart and that commitment to our youth and that willingness to change and transform, because that is going to take some courage. And I'm just so grateful for everything that you do, because I do believe every day you are saving lives. Thank you so much.
It's now my great pleasure to introduce our next speaker. Andrea Turnbull, LCSW, is a program manager at Santa Cruz County Behavioral Health, overseeing access to services. She received her undergraduate and master's degrees from San Jose State University in clinical social work, specializing in issues affecting older adults. Prior to joining the county in 2017, she was a director of Community Connection, an agency contracted with the county to provide employment and education services and counseling to persons receiving special mental health services. Andrea also spent 7 years counseling and supervising a prevention and early intervention team serving youth aged 18 to 25. Please join me in welcoming Andrea.
Today, my goal is to really talk about three things that the county is responsible for: our crisis continuum, some of the suicide prevention grants that we have that are funding our suicide prevention services, and finally, what is the future of the services offered at the county, and a little bit about the AB 988, which actually is the funding source for our 988 call services. All right, I did have, Dr. Fiore was very kind to send me some statistics locally. So here are some recent statistics for suicide deaths in Santa Cruz County by age. When you look at the data, you can see that youth suicide, although is horribly tragic, is also not a huge number, which for our county is amazing, but I think our goal here for all of us is to really reduce this number to 0. And so what I'd like to talk about today is what kind of efforts the county is making to reduce the number of suicide deaths for all age brackets to 0. All right, so I'll talk a little bit about the services we offer. First, our mobile emergency response team for youth. We actually have 2 mobile emergency response teams. One is for adults, and it's been around for a while. But in 2020, we received a CHAFA grant to provide services for youth in South County. The mobile emergency response team is made up of a team of 1 licensed clinician and one bilingual bicultural family partner that's in contract with Community Connection. We can respond, and now in 2022, we also have a grant from CHAFA as well to offer these services in North County. We have 2 mobile emergency response team vans, one that just arrived and we're getting it ready, and the other that is available in South County to respond to youth in the community and at schools, to provide crisis services in situ so that youth do not have to come to an agency that has a very heavy door to walk in the door to receive services, but we can actually provide these services in the community for our youth aged 18 to 21. What happens is we have an 800 number. Someone calls the 800 number, and the Mobile Emergency Response Team, or MERTI team, is dispatched to the location, often a school, and then they'll meet with the youth and the counselor and potentially family members as well. They provide the instant crisis services. The first thing that they'll do is talk to the youth and then try to do some safety planning to encourage the youth to be able to safely return back to the community or back to home. And if that's not available, they do have the authority to be able to write a hold and then transport that youth then to the Crisis Stabilization Center or the emergency department if needed. The Mobile Emergency Response Team for Youth, or MERTI team, also has the ability to lift holds. And so one of the things that we've been able to partner with our hospitals is to be able to go in and evaluate holds that have already been written on youth to determine whether or not, after a period of time in the emergency department, they are then able to return safely to the community through connecting them with community resources and safety planning. The number of youth served by MERTI in 2021 was 272. In 2022, it was 361. All right. Oops. Sorry, I have more. We have mental health liaisons embedded with our law enforcement agencies in Watsonville, Santa Cruz, and with the Sheriff's Office. We have 2 mental health liaisons. They are licensed clinicians who travel with officers that are dispatched through the 911 call center. They attend to crises in the community where law enforcement has been called to be involved. Someone can call, when they call 911, they can actually ask for a mental health liaison to be dispatched if they're available to the call. And so they'll go out and do some of the same similar things that the MERT and MERTI team do. They will meet with the youth or the person in crisis and try to safety plan with that person to keep them out of the crisis stabilization and to keep them out of jail. So the idea is that the mental health liaisons actually provide that bridge to keep people out of more high-intensity services. The other thing that mental health liaisons often, or not often, but when a suicide death occurs in our community and police are called, the mental health liaison is often the first responder who attends to the family or the people who are the lost survivors. And so they are our first mental health touch to people who are lost survivors. This Mental Health Liaisons was a pilot program that started in 2013 and has grown to include, like I said, the Watsonville Police Department, Santa Cruz Police Department, and the Sheriff's Department. We have 1 mental health liaison, bilingual, bicultural, in Watsonville, and we're hoping to bring that to 2. In 2022, the mental health liaisons served 352 youth. We also have at the county access walk-in crisis services for both youth and adults. And those people can walk in our door anytime during business hours and receive crisis services from a licensed clinician. They too have the ability to safety plan and do everything in their power to get people back into the community, but also have the ability to write a hold if necessary. We have a Rapid Connect program. This is meant to connect youth and adults, but we'll talk about youth who have come out of a hospital situation, either the crisis stabilization program, the emergency department, or a psychiatric hospital. They work with connecting these youth to the resources that either are connected to their insurance or through county behavioral health, getting them connected to services there. And I did discuss the number that were served. All right. We also have 2 very active suicide prevention grants, one through SAMHSA, that's called Building Hope and Safety. This grant provides training. We actually work with Carly Memely and her team to provide trainings in our community, some of which are, we offered the Columbia Suicide Severity Rating Scale training for all clinicians, all mental health clinicians in county behavioral health, and then offered it out to the community as well. We offer Safe Talk and Assist, similar to a family service agency. Another thing that this grant provides is motel and hotel vouchers for survivors of domestic violence. So people who come to Monarch Services and need a safe place to be, we offer motel vouchers for those folks. One of the things that we are developing is a LOSS team. LOSS stands for Local Outreach to Suicide Survivors. Building on some of the services that we already have, we're working collaboratively with our community partners to develop a more comprehensive LOSS team. And these will be folks who will actually attend to loss survivors in the immediate aftermath of a suicide. And as a reminder, this is considered a postvention, and we also look as postvention as prevention. One of the other things it provides is a mental health pocket guide. I have distributed hundreds of mental health pocket guides today. They should be on most tables out there. Please feel free to grab one or more. And if you need more of them, please feel free to reach out to me and I will get you more. And finally, it provides a suicide prevention coordinator salary. Our other grant is through the California Department of Public Health. And it's a comprehensive suicide prevention grant, and its primary functions are to create protective environments through reducing access to lethal means. And some of the ways that we've been able to do this is provide lock boxes to store firearms and medications. We just received the opportunity to apply for a little bit more money from CDPH. And in the work plan, I wrote in some work with our firearm retailers. We're hoping to reach out to firearm retailers to help them become suicide prevention workers as well. And CDPH also works with our local pharmacists to train them on suicide prevention as well. And the other part of this grant is identifying and supporting people at risk through gatekeeper trainings, and the primary training that we've offered, actually in-person and virtual trainings in CALM, or counseling access to lethal means. So where are we going? A little bit about AB 988. So this is, although federally it provides for the call center, the state of California also passed Assembly Bill 988, which provides locally for our call, text, and chat with the 988 number. In addition, in the future, it provides for 24-hour mobile crisis teams. These will be able to respond in a timely manner. It will be an extension of what the county provides with our MERT team. And the intention is that they will respond without law enforcement unless there is a serious crisis that requires law enforcement. The 5-year implementation plan is due the end of this year on the 31st of December. And at that 5-year mark, it should be fully implemented by the first of the year in 2030. All right. So in order to build this 988 24/7 mobile crisis unit, we are partnering with a company or an organization called Crisis Now. Their project goals are to provide sustainable crisis response plan, to better meet the community needs, and to reduce incarceration and hospitalization. And the ways that they do that, and what they're helping us with, is the 24/7 crisis call hubs, so that this will act as like air traffic control when 988 receives a call, to be able to actually deploy the mobile crisis team. It actually provides then, what do these teams look like? The idea is that it'll be a clinician and a peer that will go out in partnership to attend to crises in the community. It provides for the expansion of crisis receiving facilities. And finally, really focusing on recovery orientation and trauma-informed care. And some very exciting news. We have recently hired James Russell to be our Senior Behavioral Health Program Manager, overseeing all of our crisis continuum services and access. We have recently hired a crisis manager, Danielle Long, who has a ton of experience working with the mental health liaisons, indeed. And we've hired a suicide prevention coordinator who will start, I won't give her name until she's sitting in a chair, but she's supposed to start next week. And finally, on the horizon, we have our Youth Crisis Stabilization Center and residential facility. This building will go up at 5300 Soquel Avenue. It's actually the Bay Federal building. We're revamping it. On the bottom floor will be a youth crisis stabilization center with 8 chairs, 8 beds, and above will be a 16-bed crisis residential. I know you have access to these slides. I did put some really helpful resources here at the end. In addition, I put the Spanish and English version of our mental health pocket guide, the link to that. So you feel free to take that and print that as needed. And again, feel free to reach out to me if you want printed copies. And thank you.
Thank you so much, Andrea.